stay with one of our top stories tonight. The Eastern Cape has now overtaken Gauteng as the province with the second highest number of COVID-19 cases in the country. It's also been sitting with a massive backlog of more than 20,000 COVID-19 tests. Now, what are some of the dynamics that are making the province struggle with the pandemic? We're joined by Professor Lungile Pepeta, who is the Executive Dean of Health Sciences at Nelson Mandela University. Good evening, Prof, and thank you so much for your time on News at Prime. Firstly, if you can, have there been any parallels that you have been able to draw between what's happening in the Eastern Cape and what we've seen happen in the Western Cape?
Yes, thank you for that, and good evening to the viewers. It does happen then that in the Eastern Cape we are seeing escalating numbers of COVID-19 and we are catching up with the Eastern Cape. It must be understood that there was an exodus of the Eastern Cape fellows from Cape Town when the farming season was over, and quite a number of those were found to be COVID-19 positive. So we are now bearing the brunt of that over and above our own local spread of the disease.
Sure. What you're talking about happened when we entered level 4, which was about a month ago. So why do you think it has taken so long for it to be able to reflect in the numbers too?
It is my suspicion that we've always had this disease spreading, and it continues to spread. And what we are seeing right now is actually a tip of an iceberg. And now, based on the fact that we have challenges regarding testing, we will never know the extent of the disease in the Eastern Cape province, particularly in the rural areas, where it is very, very difficult to access and do testing in those areas. So it's always been there, the numbers have been there, and it is my suspicion that we are seeing numbers that could even be 10 times more than what we are reporting.
It's interesting because you bring up the issue of rural areas, and earlier in conversation with the superintendent of the health superintendent in that province, he said that there were events that are often held, funerals among them, where the spreading then of COVID-19 takes place. Do you think that enough has been done to inform and educate people about COVID-19 in these rural areas?
Definitely not, because I mean, one can attest to the fact that lockdown has not been effective in the rural area. You see people on social media and you talk to relatives in the different people walking around without masks. There's no concept of social distancing and all the other measures that they need to take to prevent the spread of COVID-19. And much education is needed in those areas.
Of course, part of the danger there is that many of those who are ill will often go untreated. I mean, not that there's a vaccine, but for those who do become quite ill.
Yes, and the tragedy around this issue is that there's quite a number of people that are going to fall ill, and some of them serious, and some of them actually succumb to the disease without being diagnosed. Because of the challenges that we're having now and the challenges that we have around testing seem to be escalating every day. The delays are far too long. In fact, for me, I would say South Africa needs to change the way they approach this disease. In terms of chasing the test, which now has become a luxury, certainly in the public space or in state, we need to ensure that if you are symptomatic, you isolate and you are taken as if you are COVID positive.
All right, let's leave it there for tonight. Professor